Hi, and welcome to our program. I'm Dr. Lewis Hassel, Professor of Pathology at the University of Oklahoma, and I'm glad you're joining me to talk a little bit about pathology and how to make the diagnosis as we review through a case. Let me share with you today's case, which is not a particularly challenging case, but one that we don't see very often, and so I thought I'd share it with you. So here's the symbol of our campus, the sower, and hopefully that's what we're doing is sowing some ideas in your minds that will take root and build up a strong desire to practice pathology and do good by your patients. So the patient is a 67-year-old man who has hematochezia and comes for colonoscopic evaluation. It's evident pretty quickly to the endoscopist what is going on as he, shortly after entering the bowel, discovers a mucosal appearance that looks like this in the rectosigmoid. And as you can see, here we have the normal mucosa, nice reflectance here, and areas of an abnormal vascular blush here in a somewhat irregular and branching pattern in a couple of different areas. So the endoscopist makes the diagnosis of vascular angiectasis and then goes ahead to cauterize and, fortunately for us, to biopsy the sample. So let's take a look at that sample here now. Here's a nice low power view of this sample, and it highlights something that I think is a pitfall. If I had not known the history in this particular case, I might have just glanced over this and signed it out as normal colorectal mucosa. Next case, please. Even coming here into the bulk of it in higher magnification, I don't see too much that really jumps out at me, except maybe a few little clues here. And that is here this somewhat dilated thin-walled vessel down next to the muscularis mucosa. I don't see, well, here's a little bit of a funny vessel here. But as we look a little further, I think you can see here is a cluster of vessels with this nice thin wall branching up into the mucosa, very, very close to the surface epithelium and extending over here a bit of a distance. So this finding, coupled with the history, makes the diagnosis really quite easy. But I emphasize here that it's only easy if you're aware of the history and you know to be looking for this subtle kind of change. If this was a rule out polyp, I might not have even gone to high magnification because with that diagnosis, I'm primarily looking for coloration changes rather than these subtle, slightly dilated vessels here that just barely begin to make their appearance here towards the edge of the sample. So this can be a somewhat subtle microscopic finding and one that you need to be aware of and be alerted to by virtue of the history. When I was in training, we referred to this often as angiodysplasia because these are abnormal vessels. Their growth is an abnormal pattern, but that is a misleading term. And although I've used it in some of my medical school lectures, I'm going to get away from it. A better term would be vascular ectasia or angiectasia of the colon, although this can occur really anywhere in the GI tract, but most commonly is in the right colon. Our case, obviously, in the left colon, and typical of the clinical findings is that this tends to increase amongst older patients. It is a fairly frequently recognized cause of lower GI bleeding and is therefore treated as such. So surprisingly, it doesn't show up on the biopsy table very often because it is endoscopically recognizable and the treatment doesn't usually need to require a biopsy. In fact, the diagnosis can often be made radiographically. In my early clinical days, when I actually did some nuclear medicine, we would occasionally use tagged red blood cell studies to identify points of accentuation of the marker in the colon and watching its traverse. But that took a fair length of time, was a little bit cumbersome, a little more readily diagnosed, readily used tool today might be the use of CT angiography, where a radio tracer can be injected intravenously, and then areas of brightness in an abnormal location, indicating extravasation or spread of the marker outside of the vascular tree can be identified. So our final sign-out diagnosis on this case was vascular ectasia of colonic mucosa. Next case, but certainly a nice little gem to have in the back of your diagnostic memory so that when it comes along, you'll be prepared. So thanks so much for joining me. If you enjoyed this, please hit that subscribe button, the like the video. That helps others find us. And with that, I will say thanks very much, and I look forward to seeing you again on our program.